Welcome to it. This is the hashtag Co-Create Design Festival 2021. And of course, this is day two, and I am Upia Wakomanata, better known as Lady P. And today's topic is access to healthcare. We're here at the Athlone Stadium, where there's a walk-in and drive-through vaccination site. And today I'm going to be joined by Fatima Peters, who actually manages the day-to-day runnings of what happens at the vaccination center. So let's talk to Fatima, and just to find out more of exactly what happens here, the day-to-day runnings, and how many people actually come to vaccinate in the comfort of their own car. It's a different one around the country. This is the first ever. So let's get straight down to business. Welcome, Fatima Peters. Welcome to Co-Create Design Festival 2021 site visitor. Now tell us about the vaccination site and what actually happens here on a daily basis.
Hi, thank you for being here and visiting us. So we basically have two parts of the vaccination site.
Mhm.
There's a walkthrough that you can come in and basically you park your vehicle and you come through the walkthrough site.
Mhm.
Then we have the drive-through where we actually standing now, where you
Yes.
basically remain in the comfort of your vehicle and go through the process in your vehicle. We try
Mhm.
and accommodate you as far as we possibly can.
Mhm.
So yeah, so those are the two parts of the
Of
site.
the site. That's absolutely beautiful. Now tell us about how the process works when you come through to the vaccination site. What actually happens when a car comes through or a walk-in person comes through?
So basically, we have 5 touch points that each
Mhm.
citizen touches.
Mhm.
So the first is a screening where we
Mhm.
test you. We basically screen you for eligibility to see if you can have the vaccine on the day. There
Yeah.
are some exclusions. For example, if you have COVID symptoms
Mhm.
or you've had a close contact with a COVID person in the
Mhm.
last 30 days, you don't have your ID on the day. Well, we try and help you as far as possible
Mhm.
if you don't have the documents. But the COVID symptoms, COVID exposure are uh, reasons for deferring the vaccine. So we won't do it
Mhm.
on the day, but we will defer you for a later date. Then touch point two basically is where we do your registration. You register for the vaccine. Some people register prior to coming.
Yeah.
Some people register and need assistance, so we will assist you to register. We do have to do a verification as well with all your personal details. So that's touch point two. Touch point three is where you actually have the vaccine.
Okay.
So that's where we administer the vaccine. We capture that you've had your vaccine.
Mhm.
And then touch point four is the 15-minute observation period to just check that you don't have, that there are no adverse reactions to the
Mhm.
vaccine. And then the last, which is we hope that no one really ever has to experience, is when there is a reaction and we need to treat you for that reaction.
Mhm.
So that's basically what will happen when you come through the drive-through or the walk-through. For the drive-through, you can remain in your vehicle at all times. For the walk-through, as I said earlier, you park and then you walk through the system.
Which is in the comfort of your own car. You literally get the jab,
Yes,
which is
yes.
absolutely beautiful. Now, how would you describe the whole site to somebody who's actually skeptical in getting themselves vaccinated?
So, look, some people are just refuse, and some people,
Mhm.
for whatever reason, they have done their research and they have made a decision.
Mhm.
So I think myself and there are many other healthcare workers, we always encourage people and say, make an informed decision.
Yeah.
You know, find out from various experts. Your auntie down the road or the Google chat is not an expert. You know, rather make sure that you find out. So the nice thing about the site here is that we've capacitated really well. So we are able to deal with people who have questions as well.
Mhm.
So there have been people who have come and been unsure and still wanted to clarify aspects. So
Yes.
there are nurses on site, there's a doctor on site who can guide you and advise you and answer your questions. And actually, most of the people who have been unsure and hesitant have eventually proceeded to have the vaccine. And just in terms of the team, there's a team, an administrative team as well, who
Mhm.
can assist you if you're having issues with the registration. the system is online. If you do not have an identity document, you lost it, or you have never had one because you live under the bridge, or find yourself in that situation, we assist you manually with that as well. So in terms of capacity, we really have a large capacity to be able to assist people with whatever problems. We just want to
Yes.
vaccinate you.
Which is essentially important in getting your jab. And I love the fact that you said that you actually assist each and every single person, whether you have an identity document or you don't have one. In the Now, let's talk about how many people that actually work at the site, because it's quite a big one. You have the walk-through, you have the drive-through, so it's quite a big number of people. I'm assuming that actually work here.
So, approximately in total, to run this site, we have about 100 people to run the site as it is currently. We do have capacity to expand if the need expands.
Mm-hmm.
At the moment now, because of the hesitancy, the numbers are not that high.
Mm-hmm.
So, the site has the capacity to vaccinate up to 6,000 people per day. So,
Mm-hmm.
that is the amount of staff we can mobilize if it's necessary, but it's not necessary yet. So this current site, currently, we're running 22 cubicles on the walk-through and the 5 lanes on the drive-through. And the drive-through has about 45 people on duty per day, and the rest are at the walk-through.
Now, how has the receiving as people that come to get vaccinated, how has the response been? Do they actually come through? Like, how many numbers are we talking about in a day?
For the drive-through, the uptake has been really great. It has met our expectations. We were unsure because, as you mentioned, there's not that many. There is, in actual fact, there is one in Gauteng.
Hmm.
It's not capacitated the same as ours,
Yes.
but there is one there. And so we were unsure what the uptake would be, but it's really been good. On average, we see about 280 vehicles coming through on a daily basis, and we vaccinate on average about 600 people at the drive-through for the period that we are open.
Now, do you find yourself in a case of most? I mean, we are in a local community, and how obviously people come from different communities. Because I remember when I got vaccinated, I literally went just down the road from where I live. How is this response been from the community around in actually making sure that they actually come to vaccinate, whether it be a walkthrough or whether it be a drive-through?
It's actually it's lovely. When we were walking to the interview now, we walked with a resident who lives just over the road with her baby in the pram. So she came through the walkthrough. So the uptake of local residents has been great. It's very accessible, so people, the taxi and the buses, in actual fact, must pass the stadium. So
Hmm.
it's easy if you're coming with public transport, and then people in their own vehicles have come from different places. They've come from outside of the Athlone area. So the uptake has been fantastic. The little businesses have been sending their people. This morning we had approximately 40 traffic department students coming through in batches. So because we're so well capacitated, we can accommodate groups. At the moment, now at 1 o'clock, there's a local football club who's coming. I think they're bringing about 16 of their footballers. We've had high schools sending of their matriculants. And then little families coming in the drive-through in their bubble. Um, it's just been the horse and cart pair that came about 2 weeks ago from Manenberg, and basically trotted the horse from Manenberg to come. Uh, the site was originally, the drive-through was originally designed for motor vehicles and low. I don't know if you can see the tent, but the tent has a maximum
Maximum height.
height.
Yes.
And then one afternoon, about a week ago, they called me and said, there's a truck that's higher than the height. And
Yeah.
I said to them, it's okay, send the truck through lane 6. There's only 5 lanes. And they said, lane 6. And I said, alongside. So we created a lane 6. So, we're trying to accommodate people as far as we can. People are coming from as far as Milnerton, Greenpoint. So it's not just the local community that have taken up the
The
opportunity.
initiative.
Yeah,
Yeah.
yeah.
which is absolutely beautiful. Now, how would you encourage somebody who's actually still hesitant in getting their jab? Because, I mean, truth be told, it's been 2 years since we've been dealing with COVID-19, and it's only now that we've actually gotten a glimpse of hope in terms of getting vaccinated and making sure we're all healthy and safe so that we can go back to our normal lives. So, how would you actually advise people who are still a bit of on the edge when it comes to getting their jab?
Look, it's actually somebody, my son said to me, I said to them, you guys must advocate for the vaccine. And they said, Mommy, the vaccine is the new politics and the new religious discussions. You don't talk about it because you don't know what reaction you're going to get.
Mhm.
So I will answer this from 2 points. One, as a health professional, look, I know many of the people who participated in the manufacturing of the vaccine, researching, who participated in the pilot, and I trust them, and it's people with high integrity.
Mhm.
I also have to say that having after the bulk of the health care professionals have been vaccinated during the third wave, we had far less colleagues who were ill.
Mm.
Our workforce remained steady, far more than in the first and the second wave where people were dying and hospitalized themselves. So I witnessed that myself. Then I was vaccinated and I have been really, really healthy. Thank God. I've not even had a cold or a flu.
Which is
I've not been
beautiful.
off except for having COVID in June 2020,
Mhm.
which was in the first wave. So I personally am very grateful. And then I'm a mother of three and I've had all my children vaccinated for measles, polio, hepatitis.
Mm.
And so I believe in the value of a vaccine and I trust the vaccine. So as I said earlier, I really think people should do their homework and should consult. I'm not going to buy a vehicle and ask a nurse about the reliability of a vehicle. I'm going to ask the person with the skills. So I just feel if you're going to decide on a vaccine, you need to ask the people who know about it and find your own person that you trust, but make an informed decision. And again, I invite people. Are welcome to come to Athlone, and we will also try and answer your questions. We will also try and assist you with making that decision. Yeah. that-
Thank you so much, Fatima Peters. Right now, I'm going to be joined by Willen Roberts, who's actually one of the sisters who administer the vaccination process. So she's going to be taking us through about the daily happenings of getting vaccinated, what her challenges has been like, but from a sister from a nurse rather, point of view, which is absolutely beautiful. Because I mean, at the end of the day, we got to do what we got to do. We live in a different world right now. COVID hit us very hard, so we got to do what we got to do. So, ladies and gentlemen, please give a warm welcome for Willen Roberts. If it's okay with you, can you are allowed to lower your mask just so that you are audible for the camera and for our online people to actually hear you clearly. Now, from your point of view, tell us about a normal day, how it looks like when you're administering a jab or when people walk through or drive through.
So we had various normal days. So each day is not the same. So walking through the drive-through or
Mhm.
driving through the drive-through, it's quite a not a lengthy process, but a very easy process.
Yeah.
So the clients would start at screening, and then move along to verification. From verification, they move into the second tent where they actually get the jab.
Mhm.
And at this tent, they are being asked clinical questions
Mhm.
about have you had COVID in the last 30 days? Or are you sick at the moment? All
Mhm.
those questions. Do you have any comorbidities? Have you had any allergic reactions? All those clinical questions are being asked
Yeah.
before you are being administered. Then the nurse give you the option of being sitting in your vehicle.
Mhm.
Depends how many people are in the vehicle, or the nurse asks you to get out, and then there's a chair next to the station where she actually have the stuff. It's a
Mhm.
nice table, and then the patient gets the jab, and then it's being explained as they move forward to the observation area what happened in the observation. They still remain in their vehicle. If they still don't feel unwell after the vaccine, they need to put on their hazards or they blow the hood because we have a clinical team right opposite where they're facing just to make them aware of what's happening. But the stations that there are, it's only tables and chairs. All the equipment that are there are being moved in and out on a daily basis. So the kidney dishes, the sharps containers, all of those things needs to be. They start the workings in the morning. They need to cleanse the stations in the morning. They set it up. By 8:30 they start. The cars are coming through.
Absolutely.
And at the end of the day, they do the same. They clean the station. They take all the equipment because it poses a risk of having those things at the stations
Contaminated.
during the night. So they
Yeah.
take it's like picking your nice clinical bag and move along. So you put it in an allocated room which has been appointed for them, and in the morning they just get it and see that they have all the equipment and they get it. But prior to that as well, as they come on duty, we have a clinical nurse team which screens all staff members. And then we have a small huddle once a week in the morning just to give them update of what is happening and how we can move along, how we can share experiences of the clients and how do they have any challenges that they face for the day.
Now, a next question would be, what are some of the misconceptions when it comes to walk-ins or drive-throughs? Because now, have you ever find yourself in a situation where a car does come through, they do the screening, but at the same time, they're very hesitant in getting the actual jab?
So normally all our staff, the interns, the administrators, and the nurses, they're quite capable of answering the questions and facing these challenges. So we have ongoing training sessions to keep them up to date. So if they do have a challenge and the screeners or the administrator cannot answer, they call the nurse or they call the doctor. If the patient's still hesitant, they try to not overpower or to make them, they give them informed information so that they can make the choice if they should continue or not.
Right.
But we never had a case where the patient had to turn around and resist that they don't want it any longer.
You seem like your staff knows exactly what they're doing, which is absolutely beautiful. So, how is the overall atmosphere, the working relationship that you guys have actually grown to have? I mean, because when I walked in, I was like, oh, okay, I'm home. Like we're having a lot. Like it's such a friendly environment. So, what is the general atmosphere that you guys make sure that the patients and the people that come through are actually comfortable enough?
So we have a great vibe, especially in our drive-through. Our nurses are geared up. Our staff is geared up to rendering the service and giving the quality care to the clients that they need. They want to make this journey for the patient a true valuable experience that they have. So the nurses are very vibrant, and this can be seen in our absenteeism rate. We have 90% of staff since we've opened. On the 16th of August, we have 90% staff, so we have very little absenteeism. So that gives us an indication that people wants to be here and they help and assist everyone that they go along with, be in the drive-through, being in the walk-through. They're just absolutely fabulous. They love being here.
Which is absolutely amazing. Now, I want to know, does the system work? Because we have so many vaccination sites across the country, and this is one of a few that is actually quite different because it does have a drive through and a walk through. So, does the system, in your opinion, work?
So currently, yes, it does work. The patients have the options of giving us recommendations as well as positive um, feedback in terms of compliments and complaints if should they have not liked it. So the system currently we haven't had any issues that pertaining that clients would say that is a challenge and they don't like that. So we have received good feedback this far, even from patients through the walkthrough. So if they can't write, they would verbally express how they feel and how it has um, changed their lives in a matter of just
Absolutely.
getting a jab. So that has been a positive feedback from the patients
And
themselves.
would you encourage people to get vaccinated?
Of course, I would absolutely say yes. I would encourage people to get it because we are at a stage where we want to raise the infectious rate,
Yes.
have herd immunity amongst our communities, and then we can socialize again, get rid of the mask, and stop doing because that is what we as South Africans
Exactly.
like the vibe. And so currently we are curbed and I want to send a message out to people to say, come and get the jab. You are lowering the risk of yourself and your families and your communities out there. And then, yeah, we move forward so that we can move back to normal.
Which is absolutely right. We want to go back to normal lives and actually start living again and working again and making a whole lot of money. But right now, I want to focus on if there's anybody in our talk group or our online viewers that have questions and want to know exactly what had happened. So we're gonna give this opportunity for questions to be asked, and of course, yeah, have fun. Go get vaccinated, guys. Yo, go get your jab. Do have a question from our talk group. Yeah.
Good day, my sister. My question is: Our commander in chief, most of the country, said everyone must get vaccinated. Ne? Now, if we consider that there are people that don't have E- EID documents, which are South Africans, ne? And now there are also refugees that also don't have proper documentation. How are you going to tackle that issue of them getting vaccinated? Yeah, well.
Can you repeat the question?
So the question is solely amongst for people who don't have the proper documentation, if I'm getting it right, regarding getting vaccinated. How do you handle those kind of situations?
So the official record keeping is via the national system. But what we do is we have a team of people on site who will help those kinds of people, and that we will do a paper-based registration. We then manually register you and we vaccinate you. We're not really interested because some people are afraid that perhaps they are refugees, so they have issues. So we're not interested in that kind of information. We are just interested. All we have to do is we have to account for the vaccine that we administered. So we only use information to be able to account for having used the actual dosage of vaccine, and for you to have evidence that you have been vaccinated. It is then captured in a special format on the registration system with the information that we have. I hope that answers, does that answer your question?
Yes, it does. We do have another question.
Hi, we've just got a question from our online audience. We're wanting to know, do you guys offer any information desk, or do you offer an information desk to help people um, with their vaccination decision? So is there an information desk that helps in making that decision?
I'm struggling to hear.
Okay, so the question is there an information desk where people you actually not necessarily convince them, but actually give them the right information to for them to make the correct decision in getting the jab?
Yes, when somebody enters, you come in and you can say to the people at the screening at touchpoint one that you have some questions, you have some issues, then you are referred to a help desk. If the help desk team cannot answer, they will call the clinical staff on duty, because the help desk is manned by administrative staff, but they are equipped to be able to answer all the basic questions. Anything that is a little more than basic gets handled by the clinical team, of which Sister Roberts is part of that team.
That's absolutely good. There's another question from our talk group.
Uh, Another question: as a health people, ne, you know, almost like South Africa, we are a diverse races. Ne? We have our own stigmas of understanding things. Yeah. For example, there are people that are African that think this vaccination it's a devil's work, 666 or so forth. Understand? How are you guys trying to show those people with those different stigmas? But listen, no, this is there to like to assist you. You understand?
So the question is, there are people that are a bit skeptical and have their own religious beliefs. Being that we are in a diverse country, how do you handle situations whereby you actually say this is not what it's not a matter of religion or culture, but it's something that will help us as a country move forward and getting our lives back?
So the Department of Health, in actual fact, has partnered with various community leaders, including religious leaders as well. There's a particular group whose job is only to do social mobilization. So they've done extensive talks and reaching out to various community leaders, with various cultural backgrounds, ages, religions, and partnered with them. And we've compiled data and information in collaboration with those various groups. And we've asked them to help us to speak to the various groups because sometimes you're not going to listen to me even if I'm going to say the same thing. So we rather try to find people who shared the views and are also convinced, and they help us try and convey the message. But we appeal to community members because it helps if each citizen tried to be responsible enough to get the facts and you spread the facts and rather avoid spreading the fake news that goes around. So even though we have all these various groups, there's still hesitancy. So we are so open to suggestions and the help from our local community. And we are asking each individual, each person, this is not even just about Western Province, it's not about South Africa, it's about the world. So we're asking each individual, do your bit. If you've been vaccinated and you convinced that this is the way to go, you spread the word on our behalf because we won't be able to do this on our own. We started off with the Department of Health driving, and then we realized now we need other sectors, we need the community, and we've come far, but we still need the help of others. I hope I've answered your question. Okay.
Yes. Another question from our online team.
Yes, just from our online audience, Fatima, just two questions, very simple questions, but they're wanting to know, do any of your staff do promotional work within the neighborhood? And also, who was involved in the design of the site?
Okay. So yes, the staff, as I said, we're so fortunate that there's been capacity to be able to, lend staff outside of the site. So, and because of the hesitancy, so what we guided by is traditionally health services are, once we establish a health service, that is just what you must do.
Yes.
But the freedom to adapt to the need on the site has been really liberating. It's been wonderful to be able to run a service where you can redesign the service based on the public need. So the public need currently is to promote. It's to promote the vaccine. It's to promote the factual information around vaccines, and it's to promote the site and where we are, our operating hours. So yes, there are some staff that are assisting with that, handing out pamphlets. There are staff, sometimes we invite it. Amongst the matriculants, there's some hesitancy. So there is a team that will be going out to some schools, offering talks and offering education and answering questions at the various schools to try and assist with the matriculants making more informed decisions. So the answer is yes, we do have. And it's not just the Athlone site, the Department of Health has other sites as well and other teams across the metro and in fact in rural who offer that service as well.
Absolutely.
And then with regards to the design question, it's quite an exciting experience having been involved from the very beginning to now running the drive-through. So it has been quite an extensive collaboration. So the site belongs to the city of Cape Town, and it is being run by the provincial government. So the city of Cape Town has been an integral part of setting up and designing the site. Within the provincial government, we have various groups. We have our disaster management team who has been really phenomenal in the pandemic fight. So that's their business, the disaster. So they've been quite useful in setting up the various temporary health sites like the vaccination sites. Our infrastructure guys we had a host of architects who helped set up, design the structure as you see it, and to make this empty parking lot and convert it into a
Vaccination.
drive-through vaccination site. Then we also had some assistance from the Lean Institute. I think they're a South African-based um, company as well, and their business is around trying to assist us with managing waste. So
Mm-hmm.
not designing something that duplicates or that wastes the public's money. And then we did a lot of research. That's why I could say to there is a group that does drive through in Gauteng. It's not exactly the same as ours. They literally pick up the site every day and they set it up every morning because they make use of buses and gazebos. So they come to the particular site, set it up in the afternoon around about 2 o'clock, 3 o'clock, they pack up and they leave again. So we met with them, and then we also met with a team in Ohio, Columbia, where there's another site, and they make use of a big warehouse again, but very similar. Our site is very similar to those two sites. And I think what has really been great with ours is that both those sites are designed to accommodate motor vehicles, and we've now gone a little beyond only accommodating a type of vehicle. So thus far, we haven't turned away any vehicles, not a bicycle, not the horse-drawn cart, not the truck, not the bus. Yeah, we've been able to accommodate all vehicles and all passengers within the vehicle.
Which is absolutely amazing. Just one more question. Um, what are the working times of the vaccination site?
Currently, we operate only Mondays to Fridays from 8:30 till 4.
Okay, perfect. So 8:30 to 4 o'clock. You heard it right here on the hashtag Co-Create Design Festival 2021. It's been absolutely amazing. Access to healthcare is made easier. You can just get your jab at the comfort of your own car. It's easy, efficient, and trust me, do the right thing and go get your jabs. From me to you of day 2 of the hashtag Co-Create Design Festival 2021, I am Upia Wakamanata. I will be back same time, same place, maybe another day, but go get your jab. From me to you, it's peace, love, and happiness. Bye, guys.